right? So we will not agree that there's overpopulation until our own is added. Okay, okay, let's talk about ovulation, right? Everybody uses that word. Everybody seems to be familiar with the word ovulation, but I think that few people understand what it is, right? Few people understand what it is because in fertility conversation, right? In fertility conversation, this particular word comes up over and over and over again. Ovulation. There is no fertility discussion that does not include um, um, ovulation. People talk about track your ovulation. People talk about they will even tell you if you ovulate, you will conceive. And some others will say everything about fertility depends on ovulation, right? But the reality is this: ovulation is just one part of the gist, and it's an event that happens. It's a momentary event, but it's not just a one-day event, right? A lot leads to ovulation, and that is the clarity I want to bring us to. It is a process that leads to that one-day event, right? It it involves a chain of events that must be precise. It must be precise. It must be timed and coordinated. And if any part of this chain of event is weak, you have if it's weak, if it's delayed or even disrupted, pregnancy may not happen. And ovulation, even though it seems to have occurred, will not amount to anything. So let's bring some clarity to this gist. What is ovulation in the simplest possible term for both professionals and the lay individuals, right? In fact, if you've been listening to me for the past 1 year, I guarantee you that you understand reproduction more than your child that is in medical school right now. because because I think they don't even have time in schools to tell them the things I'm telling you. But nonetheless, what is ovulation? What is ovulation? Ovulation is the moment when a mature egg is released from the ovary into the fallopian tube, right? That moment, I tell you, is a momentary event. That moment the mature egg is released from the ovary into the fallopian tube, that is ovulation, right? Why? Because that egg is then available for fertilization. Because if egg is not available, there will be no fertilization. If you like, knock from now till thy kingdom come, fertilization will never happen, right? But there is something some people or many people don't realize in this whole gist. The egg that is released survives. It does not survive for eternity. It's not always there. It survives 12 to 24 hours after its release. 12 to 24 hours after its release, right? Tolu Mary, I think we'll talk about that when I'm done, right? If I don't answer it eventually, we'll talk about that. It's a good question you ask, right? So, because the egg, when it's released, only lasts for 12 to 24 hours, that is why timing is very critical in this fertility discussion. When we tell you you need to know your ovulation day, you need to know your fertile window, this is the reason. Because the egg is not always there. Do not say, okay, I can suspend knacking because my egg will always be there. No. 12 to 24 hours is no longer available. You have to wait till the next cycle. So your timing is very critical. But understand that ovulation is a system, right? Ovulation is a system. It does not just happen randomly here and there. It's not here and there. It is controlled by complex, some of those things I will not talk to you about. It's controlled by hormonal communications, right? But remember that I've said it time and again that everything about reproduction starts from here, right? So if you're trying to reproduce, don't go down there. Start from here, right? Get into her head. Martha is here. Hello, Martha. Good to see you. You're welcome. So the brain, the ovaries, and the uterus must have good interactions, right, in this reproductive journey, right? And if there is any problem in that communication, that's why some of you are still having some issues today, right? So let's talk about some step-by-step approach on how ovulation actually happens, so that some of you will understand. Because if you have knowledge, you will not really have problem with this fertility. You just know what to do, right? So the first thing that happens for ovulation to happen, to occur, is the brain will send signal. Remember I said it all starts from here. The brain will send signal, and that signal would amount to the release of two important hormones that you already know about. That is the FSH and the LH, right? Yeah. So those two important hormones will be released, and their release will cause the development of egg to begin, right? So of course, FSH will stimulate the ovaries to produce follicles. I don't want to go into all that. Leave that for your children in school. Your own is to knack and born, right? So other hormones also will rise and fall for maturation and preparation for pregnancy to occur. Then LH will rise, will shoot up. That is luteinizing hormone, right? And that's why anytime you hear LH surge, it's just that thing that triggers ovulation. And those of you that are already in your fertility treatment, remember you hear trigger shot, trigger shot, trigger shot. This is what they are doing to you. So it's just an artificial approach to what happens naturally, right? So naturally, the LH will go up, will trigger ovulation, right? So that egg will then be released, and 24 to 36 hours after the LH, that LH surge, I'm talking about natural now, 24 to 36 hours after that surge, the follicle will rupture and the egg is released. So that is why your OPKs, that is the principle on which your OPKs work anyway. So that is what ovulation is. So when the egg is released, it goes down to the fallopian tube and waits. Eggs behave like women, right? They don't go looking for anybody. You come look for them, right? So when the egg is released, they go halfway into the fallopian tube and they wait. Let the sperm cells do all the trouble and come and meet me here, right? So, but again, while he's waiting, it's in a countdown because it has 12 to 24 hours for it to be available. So if the sperm are present, they get to fertilize the egg, right? Please, let's tap on our screen. We have 26 people in the house. Tap on your screen and share the live. It's very important you do that so that people who need the knowledge can be helped. Is that okay? And make sure you share the live. Do not be stingy, right? Do not be stingy. And if you are not following me yet, please follow me now. It's very important you follow me. It's very important you follow me, right? And if you have not dropped a heart me, I always ask, why are you like this? Should I twerk for you before you drop a heart me? All right. So where was I? So now, these are all the things that happens, right? These are all the things that happen for ovulation to take place. Now, besides ovulation, because everybody says, oh, know your ovulation period. That is more important. Yes. But there is something called fertile window, right? And that window is when pregnancy can happen. And it's based on certain understanding, which I will help you with. Yeah? Because many people think that pregnancy can only happen on the day of ovulation. It's wrong. If you are meeting on the day of ovulation, you are likely to have reduced your chance of conception, because more likely you actually miss the mark. So that's why you need to understand fertile window, right? So the reason why fertile window is important is because sperm can survive inside the female body for about 3 to 5 days when it is released. So if you knocked 5 days ago, more likely the sperm is still in you. Your body is incubating it, right? So because sperm can stay 3 to 5 days, we just okay, good. That makes it good. So the fertile window, therefore, will include that 5 days before the ovulation and the ovulation day. So how many days of fertile window? Talk to me in the comment section. We know that sperm can last up to 5 days in the female reproductive tract, right? Plus the day of ovulation. That is 6 days, right? That is 6 days. So your fertile window is 6 days. 5 days before the day of ovulation. And the best time, not the best time, because your fertile window is the best time, right? But the most optimum time in the fertile window is 2 days before the ovulation. I think I just thought to myself, that is too much information for you guys. That is too much information. But learn it. Nobody will tell you. Even when you pay for consultation, nobody will tell you. You just go straight, give you drug and get out. Right? So but again, understand that ovulation alone is not enough. Ovulation alone is not enough. Even if ovulation occurs, right, pregnancy may still not happen. All right, just hold on. I will tell you about that pain you're asking. All right. But for now, even if ovulation occurs, pregnancy may still not happen. Why? Because ovulation alone is not enough. Right? Now, there are other factors that must align for pregnancy to occur. Right? So who's ready to know the other factors? Talk to me in the comment section. I need you to engage in the comment section. While you are tapping, comment and share. That is how to engage. While you tap, comment and share. So who's ready for the other factors that must align for pregnancy to occur. Ready? All right. Talk to me in the comment section. Just type ready if you're ready to hear. Now, okay. All right. So other factors besides ovulation that must align include healthy sperm. Did you notice most of the people that asked questions earlier, did you notice I asked them about semen analysis? Because without quality sperm, you can ovulate for Africa, right? And pregnancy will still not occur. So other factors include healthy sperm. And of course, in the last month, we had 30 days of male infertility discussions. And I told the men, I taught them how to produce precious sperm. So there is no man who has been listening to me here now that don't know how to produce precious sperm. I tell you. So for those who missed it, don't worry, come and pay me. I'll teach you how to produce precious sperm. And I think women should demand for precious sperm. You don't be cheated. You say, oh, is sex food? Yes, sex is food. What is food? Food is anything that you put in your body for nourishment and vitality. And you knack, semen is put in you for nourishment and vitality, right? So if you are not knacking, you are missing out on that part of food, right? Somebody said, do you want to eat before you eat? So which one do you want to do? You want to eat before you eat, or you want to eat before you eat? Some people are just looking at me as if they don't know what I'm talking about. Anyway, so if you don't like what I'm talking about, leave the live stream. I'm talking to people who are ready to eat before they eat, then have babies, right? All right. So where was I? All right. So I was talking about other factors besides ovulation that is necessary for pregnancy. And I said healthy sperm is one of them. I've taught about how to produce precious sperm. If you've missed it, just go to YouTube, search my name, Dr. Godwin EMB. The videos are there. I taught 30 days how to produce precious sperm. And if you're not producing precious sperm, I feel sorry for you. Oh no, I rather if you are not collecting, because most women, people here, most of them are women, just few men, right? So if you are not collecting precious sperm, you are cheated. That is one. Number two, we also declared Black Friday for knacking, right? So go and knack for your life. Mrs. Kamara said so. All right. So the other thing that must align as part of the other factors that is necessary, you must have open fallopian tubes. Open fallopian tubes. If your fallopian tubes are closed, the sperm will not be able to find the eggs, right? So if that is your case, just go and do IVF. They will bypass the blockage and you carry your baby. I know IVF is expensive, but it is what it is, right? So please take it seriously, right? So you must have open fallopian tube as another factor. You must have good egg quality. What determines egg quality is not you, it's age. As you grow older, 35 and above, the quality of egg begin to diminish. That is why you have more miscarriages in older mothers than younger mothers, because of egg quality. The body can never compromise standard. If you are pregnant today, it must go through quality assurance checks. And if it does not meet the standard for a human being, it will delete it. That's why you must have quality sperm, quality egg, making a quality embryo. If these two does not make quality embryo, the body terminates it. So that miscarriage is just the body's quality assurance master that is doing his job, right? Right. So the other thing is, besides the top three I just mentioned, you should also have proper endometrial lining. Your endometrium must be thick enough. Why? Because the endometrium is like your garden, the soil of your garden, right? If it is not plowed, if it's hard and thin, implantation will be difficult. So you cannot implant in a hard soil. The same thing goes to the uterine wall. So after ovulation, the luteal phase is the phase where progesterone begins to prepare the lining. So that's why some of you, they test you for progesterone, they test you for all those things, just to be sure that everything necessary is in place, right? So the lining must be thick. So you have good lining, good egg quality, open fallopian tube, healthy egg, and ovulation timing. Bam, you will be pregnant. I said all that to say that ovulation is not ovulation is necessary, but it's not sufficient. Ovulation plus these other things is what will make it sufficient. All right. So I want to go into signs of ovulation. Right. Let's look at a few of them. And I'm sure it's going to help a lot of people. Right. So the first one I want to draw to your notice is cervical mucus. I saw somebody mention that in the comment section. I could not answer, but I saw it. Cervical mucus. Now, the cervical mucus change in its consistency across the months from phase to phase. That mucus forms a plug that covers the cervix. The reason the mucus is there is to prevent entry into the uterus. Not just anything is allowed into the uterus. Otherwise, the living woman will be a bundle or a sack of bacteria going all over the place in our uterus. So that plug must be there so that it does not allow entry, right? Not even John Thomas can pass through the cervix. John Thomas does not get there. So if your John Thomas is getting there, right? Right. So the mucus in the cervix is there to prevent entry of any kind, including sperm. However, the hormonal changes across the month in the 28-day cycle, or rather whatever duration your own is, but the monthly cycle, there are 4 phases. That hormonal changes make provision for the alteration of the mucus consistency. So from flaky white to creamy white to egg yolk white. Do you understand? So when you now see egg yolk white is the a stretchy, clear egg white appearance. When you see that, ovulation is near, right? Ovulation is near. Now the reason why that consistency is good is because it thins out to allow sperm to swim through, and also pH drops so that it does not kill the sperm. Is that okay? If you understood anything up until this point, talk to me in the comment section. Type understand. Type understand if you understood anything. So that egg white consistency that you see is necessary. Is necessary for sperm to be able to pass through. By the way, how many of you have seen my video, the video in my profile, of how sperm the travail of sperm before they get to the egg? There's a cartoon there, there's another video, just 2 videos that shows you the kind of things that sperm had to go through, right? Everything I'm saying now is actually in that cartoon, right? So that cervical mucus during the time of ovulation is necessary for sperm to swim. So if you're trying to conceive, you should be looking out for egg white, stretchy, clear mucus. Is that okay? Now the next one. The next thing is I'm seeing some of your questions. Just relax. I'll answer them. You feel pain when you ovulate. Calm down. I would even answer the question before the Q&A. Is that okay? So the second one is mild abdominal pain. Remember, we're talking about signs of ovulation. We talk about cervical mucus. Now there is something like mild abdominal pain, because some women, not all women, some women feel slight pain during ovulation. I think the name they give that is mittelschmerz or something like that. Mittelschmerz. I don't know why Oyibo people like to put their name on things, right? As if it's them that discovered it. So it's called mittelschmerz. That's pain. That pain that comes with ovulation. Some women actually feel that slight pain, right? Nothing is wrong with you. The reason is irritation that comes from, should I explain that one now? Okay, now this is what happens. You remember the wall of the ovary needs to rupture for the egg to come out. So that process of rupturing, water and tiny amount of blood can just splash around. So it is that splashing that irritates that part of your abdomen that you feel that pain. So it's not a big deal. Is that okay? What I just explained to you, even your child in medical school, they don't tell them this one. So some of you will be more knowledgeable than the person where you pay school fees for. All right, that is number 2. Number 2 sign of ovulation. Number 3 sign of ovulation is increased libido. Aha! We are back to knocking again. Libido. If there are men in the house, come closer. Women, shift back. Let me talk to guys. I want to cast update. Right? If there are men in the house, come closer. Let me whisper something to your ears. All right. So increased libido is another sign of ovulation. You see that time of the month where women they are feeling all lovey-dovey, right? They are just all over you like worm or like cat, right? They just want to make sure you are comfortable. Have you eaten? Should I bring your food to you? You know, hello, how are you doing? Na lie you, na lie you, na ovulation. Oh. Na ovulation. If I were you, I will use that time to ask Alpha, give me your ATM, I beg. I won't go. The chick go give you sharp sharp. Women when they like to comot money, but that time their money go comot. so 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 increase libido. Why? Because nature put it that way. They need to have that experience to allow for them to collect woto waiting no good, so that pregnancy will happen. Right? Lady G said, if I hear ATM, I go clear. No, I think men take advantage of this ovulation time. Right? Don't ask for anything, just ask for ATM. Right? Spend though, because after ovulation, your name na sorry. I take end up in this class. Right? So that nature does made it that way, so that you collect woto. So, and it's important for pregnancy, right? So everything about her temperament, everything about her desire, even the cervical mucus aligns so that pregnancy would occur. It's like instinctive demand, right? Instinctive demand. Knock me, waiting no good. All right, so that is libido. Libido is good. All right. The next thing is I talked about this one time. Basal body temperature. The basal body temperature will rise, and there's a reason for that, but I'll not go into all that. So after ovulation, when ovulation occurs, temperature rises slightly, right? When you see their body warm, you say, sister, wait till your body warm like this, you know wait till they happen. Ovulation, right? Is a confirmation that ovulation has occurred, right? So we know. Say, no, that's how my body is not lie. The ovulation don't happen. Right. Now, for those who are using OPKs, right? Ovulation detection kit, right? It detects the LH surge. Remember that LH must surge before ovulation. Your body is always warm. Oh boy, woto. You collect waiting no good, right? So the principle on which the OPK kits work is on this LH surge, luteinizing hormone surge, right? So it detects that luteinizing hormone has gone up. That means ovulation is happening or has happened. So it just detects for you that ovulation has happened. So that's the principle on the kits that you use. Is that okay? Do you understand anything? Or I distracted you with knocking waiting no good? Are we still together? If you're here, just type I'm here so that I'll know you are still here. So while I'm waiting for your response, let's try to understand, or rather, let's talk about common misunderstandings, right, about ovulation. Everybody talk about it. Almost everybody know about it. But whatever you know may just be a misunderstanding. So let's talk about it. Is that okay? If you are here, you're not following me yet, I think you should follow me now, right? You can also go to my YouTube channel, search my name, Dr. Godwin EMB, right? Subscribe, watch the video. So much to understand. If you're trying to conceive, if you would listen and watch those videos hard enough and do what we say to do, 80% you'll be pregnant. That's 80% chance. Right? So there are common misunderstandings that people have. Somebody said, I ovulate on day 14. No, you do not ovulate on day 14, because the reality is that ovulation varies, right? Not every woman ovulates on day 14. Day 14 is like a textbook timing, right? Using the 28th day. But this is the basic understanding you need to get. Ovulation is the 14th day, or rather 14 days before the next cycle. Comprehend? 14 days before the next cycle. That's to say, if your cycle is 35 days, for example, 14 days before the next cycle, right? It's not 14 days into your cycle, no, before the next cycle. So what do? Simple mathematics, 35 minus 14. You get the day of ovulation. I hope that is clear. Another misunderstanding is some say regular periods means regular ovulation. No, it's not so. Because ovulation may still be irregular or even weak. I hope you know that stress can delay your ovulation, shift your ovulation, or even suspend it altogether. I hope you know. So there are factors that governs this thing. So regular period is not equal to regular ovulation. Some people have periods, but they don't even ovulate at all. Right? So it will be a misunderstanding to say, I just sit at home and say, okay, because I'm seeing my menstruation regularly, therefore I'm ovulating. It's not true. You need to get evaluated, especially if you are trying to conceive. Don't assume. You cannot assume in reproduction. You cannot do that. You cannot. Somebody else said, because I felt pain, it means that I ovulated. You know, the pain I mentioned. The reality is that pain alone does not confirm that egg has been released. No. You may just be feeling pain for something else. So when you look at all the things, the signs I mentioned, put together, you can almost tell that this is when you ovulated. You don't just take one thing. It's okay because my temperature rise, or because I saw mucus change. Mucus can change due to hormonal changes too, right? So the pain is not equal to ovulation. Other things work together to make that happen. So pain does not confirm that egg is released. Sorry, right? Somebody else says ovulation guarantee pregnancy. Right? That makes sense. But understand the things we've talked about today. You remember I told you that other factors beside ovulation must align for pregnancy to occur. So if you understand what I said earlier, then you know what this is. But if you did not get it before, go to YouTube. I'll put it there by tomorrow, so you can learn something that will benefit you, right? All right. So I want to talk about problems that can affect ovulation. Problems that can affect ovulation. It's very important, and I'm sure you're really interested in that part, because I don't think there's anybody here who don't want to ovulate. No ovulation, forget about pregnancy, right? All right. So problems that can affect ovulation include hormonal balance. Hormonal balance. The disruption of signals that is necessary for egg to be released will amount to infertility challenge, right? Because hormones play a very important role in the whole of this reproductive process, from what happens in your brain down to what happens in your ovaries, down to what happens in your cervix, right? So when there is disruption, ovulation may not even occur at all. Ovulation may be delayed, or you may even have a weak ovulation, as it is put, right? Then PCOS. PCOS can affect ovulation. I'm going to deal with PCOS in details in coming days. Tomorrow is Thursday. Between Thursday and Friday, I should talk about PCOS, right? So PCOS is another problem that can affect ovulation, right? Because it may cause absent ovulation or irregular ovulation. But I'll give the details in a few days to come. Stress can affect ovulation. Why? Because when you are stressed out, brain signals are disrupted, and the control of ovulation also is affected. So it's either the ovulation will shift backward or forward, delayed or suspended because of stress. So those of you that are worried, oh, why am I not ovulating? Go and rest, right? Go and rest. Thyroid disorder, just like the question that was asked earlier. Thyroid disorders can affect hormonal balance. Yes, it does. Thyroid disorder will affect. So one of the things your doctor will be testing is thyroid hormones, right? So when you see that, don't worry about it. It's part of the deal. Is that okay? Now, extreme weight situation like obesity, or you are too thin, right? Those extreme weight limits can also affect ovulation. Whether you are underweight or you are overweight, it will disrupt ovulation. So what do we say? We say manage your weight. But largely in this part of Africa, we deal with more of overweight. So we tell people to cut down their weight. But of course, there are those who, like models, there are some who, especially those that work in, but nowadays I've seen that has changed. I used to know those days, there are certain professions like hair hostesses. There is a particular size you must be. But nowadays I see robust people as hair hostess. I say, oh, wow, that's good, right? That's good, because it means that we are beginning to loosen up. But you cannot be too big to be an air hostess. May you not go occupy the whole aisle and nobody can pass. Right? So cut down your weight, long story short. So because your weight can affect can affect ovulation, right? All right, let's take some questions.